Okay, I was asked to make a quick video about my process and protocol for scanning every single patient that comes in for a recare exam or a new patient comprehensive exam, and I wanted to share some of my thought processes with you. So we have two Itero 5D units. One of them has the NIRI, the near infrared imaging enabled, which we use in our hygiene side, primarily because the NIRI allows us to see interproximal caries and decalcifications before they're visible to the naked eye. It's pretty cool. I definitely recommend you look into it. But we have two units, so one's primarily for restorative, the other one is primarily for hygiene, although they're interchangeable and they're identical units except the one has the infrared enabled. So my process is every single patient that comes in for a new patient comprehensive exam and for a recare exam will have a full mouth Itero scan completed. Now the reason for this is it gives us a great amount of data, but also it allows us now to educate our patients in a much better way than before. So ever since I came out of school in 2006, was always taking intraoral photos, and that's a fantastic way to educate, and we still need to do that. However, the next step in the evolution of patient education capabilities is a 3D image like this. And this isn't even the newest camera. You know, the newer Itero camera is mind-blowing compared to this one. This is the second newest version. Anyway, so we take a scan on every patient. We normally don't charge for it. The data to me is much more valuable than the cost of the exam or the insurance reimbursement we would recoup. So I'd much rather not have that be a barrier for the patient receiving a scan. But once the scan is done, primarily the hygienist is going to use it as an education tool. You know, my hygienists are always looking for issues and concerns, potential cavities, fractures, occlusion issues, abfractions, you know, opportunities to suggest straightening teeth or other potential needs. So they'll use this as an education tool to help the patient see what they see, what we see. When I come in the room, generally the hygienist has already come up with a discussion list, an idea, or a list of concerns that the patient may need attention for from the standpoint of fillings or crowns or what have you. And then it comes down to me to be able to share what I see, what I'm concerned about, and then recommend treatment with the patient. Now let's look a little bit at the scan, primarily because this is the most powerful tool we have in educating our patients. So as we look at the scan here, this is a quick scan. You can see there's some imperfections. Would we be able to use this for Invisalign? Not really. Would it work for a set of night guards or retainers? Probably, but we would need a little bit more detail for Invisalign. But this is the scan that we'll acquire for our patients. And you can see, for instance, as we're looking through things, there are a couple of red alerts that you see. Patients obviously had some crown work done. And a lot of times they'll ask, well, do my teeth really look like that? You can help them to understand, well, the color's not exactly 100% perfect, but generally, yes. So for me, one of the first things that I saw was this tooth number 18, and the power of being able to do what I just did, zooming in like that, and then rotating that tooth around so we can now point out this cavity right here on the mesial with a fracture going over there, a failing tooth-colored filling, there's some cracks on the cheek side. Being able to point this out to the patient in high definition, blown up on a screen in front of them, is really, really powerful. It makes it very easy for them to understand why I'm now concerned about it, as opposed to seeing, even on a nice intraoral photo, something about yay big. Well, that doesn't really look bad. But the moment we zoom in on it, now we can start to see concerns. And to take it one step further, I can actually turn on the actual photos that were taken. And here's the infrared. So you can actually see the infrared is identifying, it's highlighting, this white is decalcification. So that is tooth decay, it's recurrent decay. You can see that to some degree. But you can see how that reflects up there. So this makes it very easy for us now to educate our patient. I can pull up the bite wing x-ray in front of them and say, that white spot corresponds with this recurrent decay here that we can see on the x-ray. So again, I know I've said it a few times, but it just allows them to see what we see. So beyond that, what I'd suggest, and one of the things that we endeavor to do every time we identify a concern, is to use this screenshot tool. So that'll capture what's on the screen. And then what I like to do is go in and annotate. So I can actually circle, we can double circle if you want to. You can draw arrows. I could now, talk about tooth number 18 needs a crown. Number 18, check. And whatever you wanted to put on there is fine. And at this point, I now keep this, I save this. And now before the patient leaves the office, when you log into myitero.com, you can actually pull up what's called a scan report, an Itero scan report. And it's a 2-page document. At the end, it's every screenshot you've saved. You now have the option to print them out in the report. So it gives you now something that you can give to the patient. Now, whether they were on the fence or not, it's something for them to refer to. So just to kind of take it backwards, my goal with every patient that comes into the office is to create a nice scan for them so that we can now educate them, even if they have nothing going on. I want them to be able to see what's going on in their mouth so that they can now move forward with treatment in a way that's not, that's not questionable to them. So let's take it one step further and talk a little bit about Invisalign. So you can see this green check mark there on the Invisalign emblem. If you've logged in with Invisalign Outcome Simulator Pro, it'll give you the option to import a patient's smile. Now we're going to skip past this because I don't have a picture of this patient, but we're going to jump forward. If you did take a picture with the Invisalign app or with the camera, you can now actually bring their smile into their face, their new smile. And it gives you a very basic ClinCheck smile proposal. So if you're into Invisalign, or if you have an orthodontist or an associate or whoever in the practice, this now gives a before and an after for the patients to look at, so that you can help make it easier for them to say yes if they're interested. Anyway, so our hygienists, once they've gauged the patient's interest level in straighter, wider teeth, usually we'll pull this up, and if we have a picture of the patient and they can see their own smile, it really becomes a powerful tool to help them see the end outcome. But as you can see, it's not ideal. There are a couple of things I would change on that proposal, but it's a very good rough estimate of what an outcome might be for Invisalign. And that's all built into the software. So if we go back, here's the patient. We've identified 18. We've talked about 2 and 15. I can now point out to the patient you've got some recurrent decay and a little failing silver filling. I'd recommend a filling before that becomes the need for a crown like number 18. And the same thing on the other side. They're basically doing the same thing, but my biggest concern is tooth number 18 because of the recurrent decay that we saw in the x-ray and also in this photo. We need a crown. But one thing I'd mention to them also is, hey, let's look at this tooth above it. You've got a plunging cusp, and now we can look at it from the inside. Look at how deep that cusp is. We probably ought to either smooth that tooth down when we're doing the filling, or consider crowning it in the process of working on that tooth. So, talk about powerful. I mean, when will you ever be able to have this view for one of your patients, looking from the distal, from the posterior at a cusp that's a plunging cusp? Isn't that great? Anyway, so giving patients good data, allowing them to make informed decisions without pressuring them is so much easier with the Itero or a scanner like this. And I used to use CEREC. I used CEREC for 17 years. Haven't used it in a year and a half, and I don't miss it. I'm not bad-mouthing it. It's been great. But this, for me, has been a game changer. The ability to scan, the touch screen, the ability to pull this screen up on a web browser if I don't have access to the machine. It's really fantastic. So I would encourage you to consider taking a scan on every single new patient and a recare patient that comes into the office, as well as using it for Invisalign and other treatments as needed. That's my protocol. It works very, very well. As I said, we don't normally charge the patients for a scan. The data is much more valuable. It's been a really game changer for me. It makes my practice kind of fun and an adventure to be able to play with all these images in 3D and allow the patient to do the same. Yeah, they can reach up and manipulate their images. They know how to do it. Everybody's got a touch screen now, right? Anyway, thanks for watching. If you have any questions, let me know. I'm happy to help.